Taxoplasmic Gondii by Kayla Mayo. What is Taxoplasmic Gondii? Taxoplasmic Gondii is the causative agent of toxoplasmosis, one of the most important zoonotic parasites. It consists of 3 different stages. Those 3 different stages are named the oocysts, the tachyzoites, and the bradyzoites. The oocysts are resistant stages for environmental transmission shed in cat feces, only produced by filled definite hosts. These are 2 different examples. This is day 0 and this is day 5. These are 2 different microscopic levels of it. The next stage is called the tachyzoites. They're rapidly dividing tissue stages found in all vertebrate hosts. This is another example of a microscopic level of the tachyzoites. The next stage is the bradyzoites. They're slowly dividing encysted tissue stages found in all warm-blooded vertebrate hosts. This is another microscopic level of the bradyzoites. How do these parasites spread? Organisms from oocysts invade the muscle cells of the cat's small intestine, where they form gametophytes after sexual fusion. The oocysts exit from the host cells into the gut lumen of the cat and pass out via the feces. When a human ingests the oocysts excreted in the cat feces, they can establish an infection and it reproduces asexually. In humans, oocysts open into the duodenum and release 8 sporozoites, which will pass through the gut wall. They then circulate into the body and invade various cells. Sporozoites invade various cells where they further multiply and break out and spread infection to the lymph nodes and other organs into the body. What is toxoplasmosis? Toxoplasmosis is a multisystemic infection characterized by granulomatosis, inflammation associated with tachyzoid proliferation into the tissues. How can this be transmitted into humans? Cats and dogs become infected with Taxoplasmic Gondii by ingestion of bradyzoites in mammalian or avian tissues or ingestion of sporulated oocytes from articles contaminated by feces, such as soil, water, and vegetation. Whenever a person comes into contact with the feces from an infected animal, it is then transferred into that person. Who can this affect? It can affect people that are immunosuppressed, pregnant women, people that come into contact with cat feces that are not in very good health of state. What are some of the risk factors? Not washing your hands, not washing your cooking utensils very thoroughly, eating raw or uncooked meat, drinking unpasteurized milk, using bad hand hygiene, not washing fruits and vegetables, and not wearing any gloves. What organs can this affect? It can affect your lymph nodes, your liver, your brain and spinal cord, and this is just an example of the brain and the spinal cord. It can also affect your eyes. Some symptoms of toxoplasmosis. Most people have flu-like symptoms. Other than that, a lot of people are asymptomatic. They have no symptoms, or they have symptoms of mono. Some of the symptoms in people with normal immune systems are body aches, swollen lymph nodes, headaches, and fever and fatigue. Some symptoms in people with suppressed immune systems are headaches, confusion, poor coordination, seizures, blurred eye vision that may cause inflammation in the retina, lung problems that may also result in tuberculosis or TB. Symptoms in some of the babies are seizures, enlarged liver and spleen, yellowing of the skin and whitening of the eyes. It's also called jaundice, and severe eye infections. Diagnosing toxoplasmosis in pregnant women. Some of the ways that this can be done is you may have blood tests to check for antibodies of the parasite. Antibodies are proteins produced by your immune system in response to the presence of the foreign substances such as parasites. And this is just an example of a blood draw that they may do. What about testing your baby? If you're testing your baby, they may do two different things. They may do an amniocentesis. This is a procedure which may be done safely after 15 weeks of pregnancy. Your doctor uses a fine needle to remove a small amount of fluid from the fluid-filled sac that surrounds the fetus. It's also called the amniotic sac. Tests are then performed on the fluid to check for evidence of toxoplasmosis. Amniocentesis carry a slight risk of miscarriage or minor complications such as cramping, leaking fluid where the needle is inserted. They can also do something called an ultrasound scan. This tests sound waves to produce images of your baby in the womb. A detailed ultrasound cannot diagnose toxoplasmosis. It can show whether your baby has certain signs such as a fluid buildup in the brain, which is also called hydrocephalus. However, a negative ultrasound does not rule out the possibility of an infection. For what reason, your newborn will also need an examination and follow-up blood tests during the first year of their life. How can you test someone with a severe case of toxoplasmosis? Some of the tests you can do for this is the MRI. This test uses a magnetic field and radio waves to create cross-sectional images of your head and brain. During the procedure, you lie inside of a huge donut-shaped machine that contains a magnet surrounded by coils, and it sends and receives radio waves for the brain. In response to the radio waves, your body produces faint signals that are picked up by the coils and processed into images by a computer. An MRI is a non-invasive procedure, so you don't have very many risks whenever you're doing this. They can also do a brain biopsy. In rare cases, especially if you don't respond to a treatment that they're already treating you with, a neurosurgeon may take a small sample of the brain tissue. The sample is then analyzed in a lab to check for the toxoplasmosis cysts. Some of the complications. If you have a normal immune system, you're not likely to experience very many complications of toxoplasmosis. Although otherwise people that are healthy sometimes develop eye infections. Untreated, these infections can lead to blindness. If your immune system is weakened, especially as a result of HIV or AIDS, toxoplasmosis can lead to seizures and life-threatening illnesses such as encephalitis, which is a serious brain condition. In people with AIDS, untreated encephalitis from toxoplasmosis can be very fatal. Relapse is a consistent concern for people with toxoplasmosis who also already have a weakened immune system. Children with congenital toxoplasmosis may develop disabling complications including hearing loss, mental disabilities, and blindness. These are some of the babies that have been affected by toxoplasmosis. This baby has hydrocephalus, which is an enlarged brain. This baby has been affected with the eye part of it. One eye you can see is bigger than the other. This one right here has got jaundice in its eye. You can see the yellowing of the lightening of the eye. This is just another chart that they have of pregnant women that are affected by toxoplasmosis. It kind of just shows where the animal has feces and it can be transmitted into the person, and then it's actually transplanted into the baby, and it's just a big cycle. It continues. And that's it.